Thank you all for being with us today for this historic World Health Assembly in WHO's 75th year. Over the past 3 years, COVID-19 has turned our world upside down. Almost 7 million deaths have been reported, but we know the toll is several times higher, at least 20 million. The pandemic has caused severe disruption to health systems, severe economic, social, and political upheaval. To be clear, COVID-19 is still with us. It still kills. It's still changing, and it still demands our attention. But it no longer represents a public health emergency of international concern. The end of COVID-19 as a global health emergency is not just the end of a bad dream from which we have woken. We cannot simply carry on as we did before. Chief among those lessons is that we can only face shared threats with a shared response. Like the WHO Framework Convention on Tobacco Control, the pandemic accord that member states are now negotiating must be a historic agreement to make a paradigm shift in global health security, recognizing that our fates are interwoven. This is the moment for us to write a new chapter in global health history together. In the 3/4 of a century since WHO was founded, the world has seen major improvements in health. Life expectancy globally has increased from 46 to 73 years, with the biggest gains in the poorest countries. 42 countries have eliminated malaria. We have pushed back the epidemics of HIV and TB, driven polio and guinea worm to the brink of eradication. In the past 20 years alone, maternal mortality has fallen by a third, and child mortality has halved. In just the past 5 years, new vaccines for Ebola and malaria have been approved and are now saving lives. Of course, WHO can't claim sole credit for these successes. The very nature of what we do involves working with partners to support innovation and countries as they implement policies and programs that drive change. But it's difficult to imagine the world would have seen the same improvements had WHO not existed. The challenges of today are very different from those we faced in 1948. Non-communicable diseases now account for 70% of all deaths globally. Tobacco still kills 8.7 million people every year. Obesity rates have skyrocketed. The COVID-19 pandemic highlighted the huge burden of mental health disorders and the weaknesses of health services. Antimicrobial resistance threatens to unwind centuries of medical progress. Vast disparities persist in access to health services between and within countries and communities. And the existential threat of climate change is jeopardizing the very habitability of our planet. Over the past 20 years, the world's expectations of WHO have grown enormously, but our resources have not. That there is the challenge of being a technical scientific organization in a political and increasingly politicized environment. These are daunting and complex challenges. We will not solve them at the World Health Assembly, and we may not solve them in our lifetimes. But bit by bit, we're building a road that our children and grandchildren will walk down, and which they will continue to build.